we're very excited to be doing this training with you all, and it has been a long time in the works, in the coming, and finally now in these stages, we're excited to be able to deliver it to you. So why we visit, ultimately, this program came from the initiative of finding that there is a difference when you visit with someone, and in particular when you go on various medical appointments. You know, if you have for example, a person who's needing some assistance in understanding what their diagnosis involves or what the prognosis is for their health and their medical condition, we find that this really makes a difference, that when you visit and you sit with and you are with someone as their advocate, they will have a world of a difference in terms of their experience. And that we see across the board. And I notice it in my own family. I have a large family, extended and also immediate. I have 4 young children, 5 and under. I have a husband, and he's very busy and involved, and he has many appointments himself. He actually happens to have a visual impairment and disability. So we have lots of appointments between all of us, and I'm everyone's advocate. So I understand completely when you go into that room what you can expect, and ultimately what a difference it makes to be able to be there and be an advocate for them, ultimately, especially for younger people or older people that may not understand certain things and details. So this is a great privilege to be an advocate. And ultimately, when you see the document, if all of you have the document, I'll post it in the chat as well, so you can link to it. But when you receive the document, you'll see that within it, when we refer to client, ultimately throughout it, it means to any person that you are advocating for. So that's the client in this sense, okay? And we here are inviting you to be volunteers. So this is a volunteer experience, okay? There are professional advocates, and we'll distinguish that later on in the presentation. But and they are paid oftentimes to be an advocate, a medical advocate, especially in the States. We see this is very popular, and it's a growing trend.
Yeah, often these people have a medical background and they might be
right.
semi-retired, etc. Yes. Yeah.
Yeah, but in this capacity and in this context, what we're sharing with you is a layperson's reasoning and understanding on how to be an advocate successfully, effective, and also beneficial to the person that you're meeting with, okay? And why is this so critical? Because ultimately you're an extension of the person you are representing, and you are holding their beliefs, their wishes, and their personal medical story, and also ultimately their whole framework in your guard and in your capacity as an advocate. So it's very important. It's a very important role, but also advocating for yourself and others is an important skill. So we are teaching you some of these skills, especially today. We're going to talk about communication. We're going to get into the nitty-gritties. We're going to talk about people. What kind of people are you going to speak to? How are you going to meet with people, and how will you interact with them? And it is an important skill, especially for just being with others, especially in other contexts, and to inform others about your needs, about the person who you're meeting with, their abilities, their wishes. And ultimately, it's a skill that can be learned, and the results is an empowerment. So this is the final thing which we really want to underline and stress, is that you're going to be empowered to help and empower others. So this is just a spin-off, okay? Which is really great. Sorry, no worries. So why do some people need advocates? And ultimately, it's so that you can be their voice, you can be their friend, and you can make a difference. That's ultimately what it is in a nutshell. And what's really key here is that you are an extension of a friend, an advocate, and also a liaison between that person who is being representing the medical side in the medical world to that friend of yours that you are helping to advocate for. So you're like an in-between person, and that's what's really great. So we're going to move right along here.
So I moved to the video now. Yeah. So
Perfect.
I'm going to just say a few words ahead of time, and that is that in my work, I've done a lot of, how would you say, help with advising people, helping them through their difficulties. There's several people who've asked me to be an advocate for them, and I've done some of that work, especially in the sense of, you know, they might have concerns, they might have complaints, they might have issues, and helping them through those situations. Some people might have an experience of being a patient advocate as being an advocate for their mother or their father or a family member. That's what's most common. We're asking people to consider being an advocate for those in their community around them who they might know. People, let's say if they're in a church community, in their church community that they might know, and we're going to get into that with you. But first, I have a short video to share with you.
to act as a liaison on the behalf of patients anytime there is a concern. Patients coming into the healthcare facility, it's a pretty different environment to be in when you're not feeling well. And so anytime we feel that there's a disconnect, I'm bridging that gap for both our team members and our patients to reach some type of resolution and clarification on what is good care. So the benefit of a patient having a patient advocate in the hospital is clinically, when a patient comes into the hospital, they're just looking and seeking for help. And sometimes in the clinical world, that's very difficult. You see different doctors, different nurses, you have different tests, and it all can be pretty much almost a cloudy world for them. And so the same way I would advocate for my mom and dad, it's a benefit of having a patient advocate in the hospital on behalf of the patient to speak up for them and about things that they don't understand. So when they're feeling alone or they're just not quite sure that everything's going well, with unfamiliar faces, they have someone to be able to speak for them. I remember a time a patient was frustrated because she had been discharged from our inpatient side of the facility. She'd gotten home, and as she was with us, there was a medication change to her home medication regimen. And so typically we refer any prescriptions that need to be refilled or filled in general to the primary care provider. At this time, she was trying to contact our hospitalist and kept getting redirected to her primary care physician because they just quite couldn't understand what the need was. And so in talking with her, I was able to resolve that by explaining to them that this was a prescription that had to be written out. And so in talking with our hospitalist, we were able to get that prescription that she needed. And I personally drove that to her home pharmacy. And so the patient was very satisfied. It was a team effort. And as a result, we were able to establish a new process to ensure that all patients that are discharged do leave with their home medication.
So let me give you a tiny bit of an oversight very quickly that some have heard before if you've taken the visiting program. It's the importance of an advocate. First of all, you're going to see this information. Not everybody would make an excellent advocate because someone has to be capable of speaking up for somebody and doing so in an assertive manner, etc. But they must always be very friendly, very kind, very, you never want to be in a situation where you're upsetting a physician or a nurse or somebody in such a way that you're causing actually more harm to the person you're advocating for than help. What you're also recognizing the need for an advocate is, let's say you're somebody with a significant disability or someone who's become quite elderly and has, let's say, multiple health issues. The physician may or may not know this person well. As an advocate, we'll go through that information with you. You're going to have to come to know that person reasonably well, and you're helping them then receive the care that they need. It's not that the physician or the nurse isn't trying to do the best they can, and there might be situations where maybe the physician or nurse don't have the best attitudes, but that's not what we're getting into here. What we're doing is we're recognizing that you're representing someone and helping them through a difficult situation get the care they need. And it goes into multiple areas, such as whether it be care in the hospital, care that is in your home, etc. So you're representing them. And what was said earlier in the very beginning was that you're representing them. It's about them. It's not about you. Okay. Why do we do this? Well, basically speaking, we recognize in this culture that there's a lot of people who are struggling to, receive the care they need. And these are people we know. And so the best thing we can do is help them, and you need some training in that area. When I say that not everyone be a good advocate, well, we'll get into that information later. As an advocate, you talk with the person, you support them, and you act or speak on their behalf according to their instructions. So everything is about their instructions. So you might not actually be someone who would want to be an advocate for certain people because you may not agree with them. So that's an important part of being an advocate. Obviously, if you're representing your mother or your father, if you don't necessarily agree with your mom, you might be able to talk to your mom and she sees it your way. But if you're actually speaking with someone who clearly doesn't agree with you, obviously speaking, you might not be the best advocate for them because you might be uncomfortable with that. And obviously speaking, we come from a point of view where we respect human life. So we want you to help that person receive the care they need and a respectfulness to their life. An advocate empowers their client by helping them to understand the system that affects their lives and access the care they need and make intelligent, informed decisions regarding their goals. But remember, it's always their decisions. As an advocate, you're not making decisions for somebody, you are representing them. Now, obviously, when we get into issues around, someone's got some dementia and things like that, you're getting into a more difficult area, okay? How can you help the person? Where you stand up for his or her individual rights. Okay, we obtain and maintain opportunities to have meaningful involvement with their community. So we're helping them with their involvement into community, but we're also helping them receive the care that they need. Gain access and support to disability-related services that he or she may require to have a good life. Now, those who were on the call last night for our visitor training session, I mentioned that my son, Peter, he is autistic, and my wife has spent a ton of time making sure that he receives the services that are available to him. And I made the comment last night, and I'll make it again tonight, that the fact is that sometimes these services are very difficult to obtain. And you would wonder how somebody with a disability who does not have an advocate, in the case of Peter, my wife, his mother is his advocate, that if he didn't have that, how would he obtain these services? It's not like they're just, it's not like even the person who is, let's say, a go-to person in the government is actually helping them per se, unless you actually ask them. It's a very interesting system that seems to be very difficult for some people, simply because the system's made that way. We also, as advocates, we would speak to their healthcare providers. Okay, what is an advocate not? An advocate is not someone who provides counseling. They're not someone who makes decisions for another person. They're not someone who provides medication. They're not someone who provides a case management. They're not that. What they are is they're an advocate for the person. You're helping them receive the care that they need. So obviously, when you're visiting a physician and you're talking to them with the patient or your client with them, you're representing that person, and you've spoken to that person ahead of time. But we will get into that further. To be a good advocate, well, as I said, not everybody will be a good advocate. Some people, they will not have the, how would you say, the personality that is necessary to be a very effective advocate. Because what does it require? Well, it requires a good communicator. You have to be capable of communicating with the person who's your client and helping them discern exactly what they need. But at the same time, you have to be a good communicator in the healthcare system. You need to ask questions. If you're afraid to ask questions, then you're not going to be the best advocate, because obviously speaking, when let's say you're visiting with a physician and there's a medical question, if you don't ask the question, you can't clarify the answer, right? So obviously when you're visiting, when you're not visiting, when you're having that doctor's meeting, there has to be a clarification of what's going on, especially since the person you're representing might have some types of early dementia and things like that. And so your advocacy is a really big help to that person to ensure that they know what their issues are. You need to be a good listener. You know, sometimes it's like being a visitor. Sometimes being a listener is the best thing you can do. You know, you listen to what the person is saying. You're representing that person. You must always be courteous and respectful. You know, I get calls all the time, constantly calls all the time, because what you get is they'll call us up because they're concerned about, let's say, a medical treatment question. They feel that someone's been being pressured maybe towards, you know, assisted death and things like that. And there's often then a disagreement, or you could say a chasm, a disagreement between the medical people and the family, or the medical people and the patient. And so how do you deal with that? These are not easy things to deal with, because sometimes there are legitimate concerns on both sides of that disagreement. Well, I always tell them, you know, you have to be, you know, assertive and straightforward and honest, but you must be courteous and respectful at all times. And I said, sometimes you might really feel that you're, you know, in a bad situation. You must be so courteous and respectful that maybe it even hurts a little, because you have to be this way to be a good advocate. You cannot be causing a problem for the person you're advocating for. So when we're saying be assertive and persistent, obviously you're representing this person, but you do so in a courteous and respectful manner. We must always respect privacy. That person's medical issues are their medical issues. They're not your medical issues. You're there to help them. Knowledge is power. Well, that's one of the reasons we need to ask questions. We need to find out for that person what's happening. There might be certain things that need to be known, and you're helping them find that out. And you identify or anticipate the client's unmet needs, and we'll go into that, how that's done. But obviously that's done by communication, right? That's done by communicating with the person ahead of time. And we see advocacy. Now let's get legal. Well, here's the point. You can't show up at a doctor's office, as an example, and claim to be an advocate if you're not actually an advocate. Now, obviously, if you're there with your mother, or you're there with your brother or sister, or your father, or somebody like that, or even your close aunt, yeah, the doctor might say, absolutely, this is good. This is the son coming with his mother. That's a good thing. And actually, that's a very good thing to always go with your parents to their medical appointments, because obviously speaking, what are you establishing with the physician? You're establishing that elderly person who's coming in with health problems has a family. They have significant others who care about them. I'm not putting anybody down. I'm really not, and I'm not judging anybody. I'm just saying, when they see someone who's, let's say, 87 years old coming in who've got multiple health problems, the doctor might be thinking, what am I going to do? Like, what are they expecting? Well, as an advocate, you're going to help them along the way, obviously. An advocate has a relationship, is a relationship on its own. But you carry no legal authority, right? And you have to understand that you cannot be, anywhere involved with, trying to make decisions for somebody, but you need to have a legal agreement with them. In our booklet, we have a legal agreement that can be signed, okay? Whether it's this booklet where we have the legal agreement, or you see it's Appendix A, Patient Advocate Agreement in the booklet. So if you download the booklet, you can find it. Maybe in your province, like this refers to Provincial Ontario Health Insurance Plan. Obviously in British Columbia, it's not the Ontario Health Insurance Plan, but you know what I'm getting to. So there's a contract. So obviously speaking, this is not such a legal contract. We don't see this as something that, oh, well, this is going to put somebody under my control or anything like that whatsoever, because in fact, it doesn't do that. You're just representing them and you're with them and you have the right to speak on their behalf with them. But of course, there's more to it than that. There's other types of agreements. So you can be an advocate, right? An advocate is someone who's representing that person or working with that person, helping them gain the the services they need, the healthcare that they need. But there's also things like healthcare proxies. Like in Ontario, we call it a power of attorney for personal care for healthcare. There's also a power of attorney for finances. Every province, for instance, has a different title for that document. Some of them are more similar, some of them are a little different. I know British Columbia's document on healthcare is different than Ontario, whereas most of the documents in Canada are very similar to Ontario's. There's only minor differences. Nonetheless, a healthcare proxy is different than an advocate. A healthcare proxy is when you have been appointed to make decisions on behalf of somebody when they can't make decisions for themselves. So what they've done is they've filled out the legal document and they've appointed you as their healthcare proxy agent, power of attorney, as we would say in Ontario. And then you have the right to make decisions when that person's incapable of making decisions for themselves, okay? There's also a financial power of attorney document that someone could have. I'll tell you straight, the Euthanasia Prevention Coalition sells a power of attorney for personal care. We only charge $10 for it. It's very inexpensive. It's a document that might protect you and might actually even save your life. It's been used by many people for many, many years, and the language in it is understandable. It's clear language rather than a difficult medical language or difficult legal language. And as I say, we've sold thousands of them over the years, and an incredible number of people have actually said, like, we used the document, it was simple, it was understandable, there were no issues. Financial power of attorney, I would tell people, you can appoint anybody you want as your financial power of attorney. You should be careful with that, obviously. But a healthcare power of attorney only appoints someone who shares your values. I would say the same thing for being, if you're needing an advocate. Let's say you're having significant health issues and you want someone to come with you and help advocate for you or be a friend and help you in your medical decisions. Only have somebody who shares your values. Because obviously speaking, you're putting them in a situation where they have certain power or certain influence over what's happening. So try and do that. I mentioned that really with the power of attorney more so even, because with the power of attorney, you can't make decisions for yourself. You've become incapable of making decisions for yourself. So if you appointed your oldest daughter as your healthcare power of attorney, and your oldest daughter doesn't share your values at all, it could be a problem. Now, our power of attorney for personal care also, as I say, has certain directions in it. Nonetheless, there's many decisions that will never touch on those directions. So you need to have someone who shares your values, right? So always remember that if you are an advocate, you're not authorized to make decisions for the other person, right? You are making them with the other person. You're helping the other person. You're only to represent their wishes. So once again, when I'm saying to you that you want to be with someone who you share your values with, I think that is incredibly important because you're only representing their wishes, okay? I think what's going to happen is we're moving over to Kathy.
Okay, great. Thanks so much, Alex. So when we're talking about advocates' code of conduct, this is what you are actually going to be being. This is your code of conduct. So as an advocate, this is what you want to encapsulate and enable for that successful relationship, to be a successful and effective advocate for the person you're representing and being with. And these are some of the things to keep in mind. And this is also in the book. So feel free to not have to write things down. If you want copies, we can send these to you as well, hard copies after tonight, and you can stay in touch, and we can support you as well. So some of the things that you want to keep in mind is that you, as an advocate, will be practicing with compassion, hence our name of our organization, Compassionate Community and Care, and you will respect the person you're working with whom you are working. Your primary commitments are to promote the health, safety, and the rights of the person. You will be transparent in your work with that person. And what that means ultimately is that there's nothing that is kind of under the table or shady, or, you're getting information from the doctor and you're not, let's say, relaying that onto the person that you're speaking or representing. That's very important, that we be genuine, transparent, and all around very open and genuine. You will maintain privacy on behalf of the person, and you will keep confidential all activities and records, unless speaking with your supervisor, for example, for advice. And anything, of course, you relate to Alex or myself or anyone that you are involved with in the care of someone else's health, as a health proxy and as an advocate, obviously remains confidential, and you have to keep it.
When it refers to supervisor, remember there will be people who will be an advocate because they're involved in a parish group, but there might be someone who develops an organization, and we've been encouraging that also. And there's been some people setting up these visiting organizations that they're working with, and they're being trained through Compassionate Community Care. So obviously speaking, they might have a supervisor, but nonetheless, confidentiality is of the utmost importance.
That's right. Yes. And the next point here is ultimately you will guide and assist the person in medical decision making, but at no time will you make decisions about the health or medical care or medical services on their behalf. So you're not going to imply your own judgment here for them on their behalf. You are just simply aiding and extending whatever it is their care and their needs are. You will be respecting the person's values and belief system as the foundation for their decision making. So again, as Alex pointed out really well, we want to encourage you to make sure that whoever you are being an advocate for, that you match their sympathy or the way
Their
they
values,
feel about their values. That's right.
Yeah.
Exactly. Okay.
See, we're really trying to protect our own.
Yes.
So we recognize that there's so many people who share our values, but are finding things very difficult in life today, and so they need an advocate. So I'm not suggesting that others wouldn't be helpful with an advocate, and I'm not suggesting you shouldn't be, like, especially if you're visiting someone and you're getting to know that person well. Nonetheless, remember, you're always as an advocate representing their values. I know I've interjected, but I'll move on.
That's great. So then next point here is, as a health advocate's code of conduct, this is slightly more specific now. We're going to get a little more tailored. Why? Because being an effective advocate means upholding the highest ethics and standards of practice. So this is a formal actual documentation. It is really well laid out here in this training book for you. So if you want detail on it, you can go through it all here. But ultimately, what it is it's sharing with you how to be a health advocate in the most formal sense and in the most highest regard when it comes to the code of conduct. So these are the more detailed explanations here and what that entails. So you will practice with compassion and respect for your client and their family. When we say client, again, we're referring to the person with whom you're advocating for whom you were advocating for. You will promote the health, safety, and rights of your clients. You will foster the autonomy of the person you're representing. So you're always going to uphold that. You know, their autonomy is very important here as well. And we want to make sure we always respect it. You will be transparent. You will maintain privacy on behalf of your client and keep confidential all activities and records according to agreements with them and any applicable laws. So again, each province is maybe a little slightly different, but ultimately the proxy, healthcare proxy advocacy, you want to have the same, maintaining the same high standards. Okay. Moving on here. Great. So then you're also going to guide and assist your client in medical decision making, but at no time make decisions about their health or medical care on their behalf. You will promote your client's values and belief systems as a foundation for your decision making. You will practice with your within your competency. So if you're not knowledgeable about a certain point or medical diagnosis or prognosis, don't come up with it. Don't start to become, you know, the medical personnel you never were. You're not jumping into another ship, okay? We're just using the tools and skills we already have to extend the wishes of the client that you're representing. And so you want to make sure you're promoting their values, their belief system, and ultimately you will be practicing for any requests or services outside your expertise. They should be referred to someone else who's equipped to provide those services. And again, you can liaise between these two individuals, whoever it is that's involved in that client's care. And of course, finally, we want to make sure that you don't accept any money or gifts. This is a voluntary role. So what that means is you're doing this out of your own, you know, heart and goodness and well-being, and ultimately you want to provide that for others. So you don't want to foster any kind of idea or thought that it will be reimbursed in some form. That needs to be reimbursed. Okay.
And you don't want someone accusing you that you're taking advantage of this wonderful elderly person.
Yes.
Who, like, that just doesn't go well. Don't want to put yourself there at all.
Nope. That's right. Awesome. Okay, great. So then now when we're talking about also advocating as a health advocate, you want to make sure that you're not going to fulfill any requests to perform any illegal or unethical actions. Okay, this is critical. We are not breaking any rules, any laws. The laws are there for a reason, and you are fulfilling your duty as being an ethical person and being legal and within your mind and within your means, executing your role as effectively as possible. You want to make sure that you're practicing within your competency. Again, we've already spoken this, and then you know, we don't want to accept any gifts. So we can move on. Thank you. Perfect. Okay, now this is a very specific item here. It's taken from the Long-Term Care Homes Act from 2007, but this is actually provided again in your booklets, which we can send you. And this is called the Residence Bill of Rights. And ultimately, when a person is a resident of a home, long-term care facility, you know, maybe a hospital or a nursing ward, a residential home for older people, that resident, it means that they are a person admitted into and living in a long-term care home. And they have their own set of rights and bill, especially for this role. And this is really important because ultimately what it means is that they have specific rights as a person in that long-term care facility. And now you're going to be aware of what those rights are. Okay, so we'll kind of showcase some of these here for you. So every resident has the right to be treated with courtesy and respect, and in a way that fully recognizes the resident's individuality and respects their dignity. This is key. Now, oftentimes we see, you know, this has been heavily impacted, especially over COVID. And we know people who have been impacted by this severely. So this is very important to keep in mind and highlight in our books that this is a key point here. We have to always keep a high regard for that person's respect and dignity. They have the right to be protected from abuse. And now we talked a little bit about abuse yesterday in our session on Being With, our My Story program, but there's various abuses, and, you know, for everything dealing from physical, mental, emotional, physical, and financial, and even sexual. And you may be finding that there are some signs of this that happen for a person that you are advocating for. So it is your responsibility to actually play a role to help prevent, draw awareness to that, and actually help it stop. So, and we'll share a little bit about that with you as well later on, okay? They have a right as a resident in a long-term care facility to not be neglected by the licensees or staff. So anyone who's part of upper management, you know, has a role as well. They have to uphold these standards, high standards. They have the right to be properly sheltered, fed, clothed, groomed, and cared for in a manner consistent with his or her needs. So if a person is on a, is laying down, like we mentioned this in other sessions, they have an effect, they could have a pressure sore, and this can lead to infection, which ultimately could lead to death. Now, speaking, not in kind of a theory sense, strictly, we've seen this happen. This actually played out this last summer. We had a lady who just called us, and she said and shared that her father had pressure sores, and this is below the standard. The standard is actually prevention of pressure sores. So the standard is actually already being omitted. It's being disregarded in her case, in her father's situation. So this is something that should be always upheld, that the standard is to prevent that, and ultimately this person has to be cared properly and cared for properly. Now, the other point here is they have to be able to live in a safe and clean environment. Now, this was something that came up during COVID, where we had, even before COVID, very strong, lags in terms of our healthcare system when it came to long-term care facilities. And so it's very sad to know that, we already started off on a bad foot going into COVID, right? And then that just kind of further, expedited and made it worse in terms of certain situations. And those things came to light, thankfully, but I'm sure they're still out there. So if you do come across these situations and you're not in a clean or safe environment for the person you're working with, then definitely draw that awareness and speak up. That's what your role is. You're an advocate. The person has they have the right to exercise the rights of a citizen. So just as a citizen of any home, your own residence or a condo building or anywhere else that you're abiding in, you have a right as a resident of a long-term care facility to be able to have rights as a citizen, just as you would as in any other type of home or dwelling. And they also, moving to this, we have every resident has the right to be told who is responsible for and who is providing the resident's direct care. So you can't say that there's just this group of people that is kind of indirectly involved with a person's care. No, there is someone who's always responsible for someone's care, and that person is in charge, and they need to be responsible for that person. And so there is there's a line of course of action that you can actually pursue. If something goes wrong, you can direct it to a person who's in charge, and they're responsible for that person's care. So that's important to keep in mind. Also, to be avoiding, they should be avoided privacy and treatment, to be afforded privacy and treatment and in caring for his or her personal needs. So again, if someone is in a room and they can be witnesses to another person's personal care or treatment, they need to be able to have that privacy, and that's really important. As mentioned earlier, I have this a home that's very busy with little ones. We have 4 little kids. We have 3 boys and 1 girl, and I'll mention them later in some examples because it's pretty funny. But we have a little girl that comes by once in a while, and she often says, I need some privacy, because our kids love to come into her space, and especially when she uses the washroom, she's like, I need some privacy. She's 2, okay? She's great. So it's very smart. But we need privacy, and elders, especially in people who are residents, they need their privacy as well, and it needs to be respected. Also, they have their right to participate in decision making, and that needs to be respected. So if they have a decision that they don't want certain care, they have a right to that as well, okay? So just keeping that in mind. They have a right to keep and display personal possessions, pictures, furnishings in his or her room, subject to safety requirements and the rights of other residents. So again, they don't want to have hoarding happening, but to an extent, you can have all these things that you want to have in your own space, right? And that's important, right? And it's really beautiful to see that, because when you come into someone's home, you want to have an expression of who they are, and so they feel comfortable with their own dwelling, right?
So in the booklet, there's more
Yes.
about the Bill of Rights, and you can go to that. We decided to have the first section of that covered, and you see what it gets into. Now, remember, as an advocate, you're primarily, you might be advocating for somebody who's in a nursing home. So this is why this comes up. Now, this was referring to the Ontario nursing home, the Bill of Rights, but obviously speaking, it would be long-term care homes bill. But obviously speaking, in other provinces, it would be similar to that. Ontario being a major province, that's what we went with as information. There is more information on this. It gets more particular, but we've decided to cover only the first part in this presentation, and the rest is in your booklet, and you can go to it. Okay. Effective advocacy. Well, there may be times when your client finds they're in situations where they feel powerless and vulnerable. Now we can just imagine what these situations might be. And so the important thing about the advocate is that you're going to be helping that person out in this situation. They may not want to risk angering people whom they fear could make their lives difficult. This is particularly the case for residents in a medical or long-term care facility. As their advocate, you can help them through these stressful situations. Now, it's interesting that we mentioned that last section there about items and everything, because when my mother-in-law was in a long-term care facility, she was my wife was visiting her, and she was all upset about certain things that had gone missing. And she wasn't talking about it. So Susan started asking questions to her mother about what was happening. And then she admitted, well, there's the one worker there who for some reason likes to take her chocolate from her, who has not returned all her clothing to her, even though it should have been returned a long time ago, and who's taken a few other things from her. And she said, and I don't want to talk about it because it could only get worse. And so what my wife did is she called the people running the long-term care home, and she said, my mom's just expressed that this has happened to her. And of course, Susan knew the name of the person. She mentioned it. And Susan's mother never saw that lady again. I don't know what happened to the lady. I don't know if she still had her job or not. I don't know if she got a harsh talking to, but nonetheless, it was obviously wrong what was going on. And Susan's mom was not willing to speak up for herself. So my wife did that for her mother. Effective advocates look at positive solutions to problems, and protecting the people you care for. It is easy and sometimes understandable to criticize people and organizations or systems. Always speak positively and constructively. So for instance, there might be a difficulty someone's having with their communication with their physician or with a nurse or somebody like that. As an example, we be positive, we try and find positive outcomes as best as we can. As I said, sometimes it even hurts that you have to be so kind, because obviously speaking, you're wanting only positive outcomes, not negative outcomes. How can we help? So I believe now I'm moving back to Kathy.
Okay, wonderful. Thank you so much. So how you can help is just being there. So your presence by being there makes a huge impact. Your physical being there is already putting a higher standard in terms of care and impression. If you walk into a doctor's office and you're with your parent or with your spouse or whoever it is, a friend, maybe a person you're advocating for, a child, already you are putting yourself as a secondary person on the team of the person you're being with and the advocate you're advocating for. So it's really important because right away you notice there's going to be a different discussion, there's going to be a lot more care, there's going to be a lot more attention, and there's a lot of, I see it as oftentimes more regard given by the medical staff and the professionals that are involved in the care. Yeah,
because you're establishing a community with that person. Yes.
Yeah, that's right. And they see that as a community, they've got a lot more they need to work with. And they need to look after this person because they're just not alone. They're not a single little person. They're now surrounded by a team, okay, in their park, on their side, who are going to back them and support them. And they know what the truth is. So if something later gets, disputed, there's a second set of eyes. It's like a collision. When you have a second witness there, you know that there's someone else that's going to take note of what's happening, and it's really important. So it is your presence. That's the ultimate, most important thing here, that you're actually showing up with someone. And what you're able to do in your presence is actually create empowering solutions. So you're helping create options and opportunities where they might not see them. Now, for example, my own family, when my husband has his appointments for his vision, or, we see specialists for him all the time, because it is something that is a genetic condition, there can be kind of a grim, more darker idea behind that there is not much you can do. But yet, as a spouse and also as a caregiver and as a partner, I think it's important for me to create empowering solutions. So when I see opportunities for his care or advancement, or perhaps even making less stress on his eyes possible, I try to do that. So these are just small things that you can think of as an advocate, where you can actually support the people you are with, giving them ideas outside the box to help them and support them and further them along. Okay.
Yeah.
Being aware also of options. So because you're not just the one person, you're extending that person's wishes and their needs, you're going to be able to now attract more opportunities for them to be able to be involved within their care, in support, in services that might be available to them, and even just elective opportunities, for example, that are outside of their scope. You might have a keen awareness of that they may not be particularly interested in or even available or in their right mind frame to be able to absorb that type of information. I know someone who's very close to me a few years ago. They had something where they did like a scope, inside their intestines, and they found some precancerous cells. So right away the alarms went off, and they said, "Oh my goodness, I'm going to have cancer." Well, lo and behold, I've looked that up, and actually we looked into it further with their doctors and their staff, and they said, this doesn't necessarily mean you're going to have cancer. It just means you need to be on guard. You need to be aware of what could happen in the next few years.
Yep.
So you're allowed to do that as well. And so in terms of communicating choices, we will actually go into that a little bit later. So this is going to be our hands-on portion of the evening, where we're actually going to talk about specifics. But when you're communicating opportunities and choices, that's something that can be very delicate. We have to be very gentle and very much be understanding and listening at all times to all sides, and taking very careful notes, especially here. And that's a way that you can help, because oftentimes, again, someone's mind may not be open to the receiving that kind of information when it's becoming available. And then, of course, if you need help, we exist. You're already you're already ahead of the game, because you have this amazing network of people that can back you and support you, that have a wealth of experience. Looking at Alex and EPC and CCC, we have this helpline. We can actually advance your cause, whatever it may be, to help see if there's other opportunity. Just a particular example, today we found out, we were speaking yesterday with Alex about a person that we're trying to find an MRI for. Well, this morning I get an email saying from another doctor, "Hey, by the way, we found a clinic that can make an MRI pretty quick." Make it available, make it possible. So great things happen, So when we're dealing with communication, which is our next point, which is my particular favorite, because I need to improve often on my communication.
I think you're a good communicator. I think you're a good communicator.
Yeah. Well, thank you for that. What I mean is always being on your top game, okay? And this is kind of where it comes into play when you're saying, for example, you're going to advocate for someone. You want to be polite, you want to be all these things, but when it gets kind of dirty or messy, and then other family gets involved, and then there's a dynamic or a power play, or there's someone else feels they know what's right for this person and this individual, and you're on their camp, and you're saying, well, they don't really feel that way. You're going to have to be a facilitator in that very intricate kind of playing out of expressions, and especially in relationships and communication. So this is where it can become difficult. So Alex is, I would say, the golden standard here because he is able to maintain a level and a neutrality that's beyond measure. I've never encountered this, to be honest, and it's beautiful because he is very clear on his position, firm, but ultimately what he's representing. So this is where I take advice, is where you can come across the same way. It's very effective to be firm and resolved in what your position is. So when you know who you're dealing with, you're actually able to be a stronger ally for the person you're advocating for. And the organization you're representing is obviously yourself, the organization that you're starting, if you're starting another compassionate community care organization in your community, or if you're just going out as an ambassador for someone, as an advocate on a one-off for a few people that you know. So it's important to be clear on all of that. Also, you want to make sure you're helpful, being patient, but not too persistent. That's also important. You have to know when you can take a breath and take a break. Sometimes when we spoke yesterday, we had a lady who brought up burnout. Well, burnout happens when you're not able to moderate your activity level, and you're literally, like Alex says, burning two ends at both ends.
The candle at both ends. Yeah,
that's right. So when you decide that you are involved, you have to be able to know when is it too much, right? And deciding what you're trying to communicate. So what do you want them to do? You ultimately have to have a plan or an idea, or at least a goal that's oriented, so that and your advocate, that who you're advocating for, know what direction you're going, that you're not just going to switch gears all of a sudden. Like, you're not going to say to someone who's against euthanasia assisted suicide, all of a sudden, hey, by the way, they're going to turn on you one day and say, maybe I should take that made up, that offer. So this is where we have to be very firm, right, and resolved. If you have been misunderstood, make sure you correct yourself. This is very key. And I find I do this all the time, especially with my kids, because they're young and kids listen and they pay attention. So when I say I'm going to take them to the park, if it's 10 o'clock at night, they haven't gone to the park, they're getting pretty upset, right? I'll say, we're going to extend this visit till tomorrow, right? So it's really good to know that when you're with anyone, if you do make a mistake, you correct yourself and rephrase, or you make sure you rectify that situation as quickly as possible. If you do not know an answer, just say so. Okay. If you don't understand something, ask for clarification. You're not an expert here. None of us are, right? We're all going into this with a good intention and that we want to learn, we want to grow. Making sure that you're listening carefully to whatever questions are posed to you. So if there's something that you need to evaluate, making sure you're evaluating everything from all sides is really important. That's why I encourage everyone to keep notes, and you can take a notebook with you, or you can take a little, piece of, paper and pad, if, like something to write on, so that you're able to actually capture information as it comes available. And make sure that you are very clear in what you want them to do. We mentioned that, and speaking slowly. I need to slow down oftentimes, so I will try to do that and make sure I do that, especially tonight. Okay, great. So the next point is when we're talking about, for example, key active listening skills. These are things that we want to make sure that we encourage you to be involved. Listening first, like I remind my kids, we have 2 ears and 1 mouth. So we always want to make sure we're using our ears and listening skills, always capturing that information first, and then realizing what that actually means, and then sharing it afterwards. But listening means we are encouraging a person. We're listening to inquire. We're listening also to name any type of emotion. For example, if a person that you're speaking with or you're advocating on behalf of, they can't maybe phrase what they're feeling. And there's power in terminology and language. So if you can help them name what they're feeling, it actually will help them feel that they're more in control. So for example, my kids are often frustrated. I will say to them, I understand that you're feeling frustrated. I understand that you lost that ball. You would like it back. Can I help you get the ball back? Like it's something simple, but ultimately, maybe it's just their own control. That person needs that naming of what they're feeling, because it's really hard that they feel alone. And oftentimes when we are able to, we can redirect the flow and the conversation as well. So we can bring back optimism. I often talk about my kids just because I notice it's nice. People usually like kids. It's a positive thing and it makes people laugh. And often I find too, it's nice to reflect. So when you can, for example, maybe you need to redirect a conversation, you can reflect, or you can rephrase these things. And those are really good skills for listening that you can help guide that conversation, guide those moments that can be a little bit more tense, especially when there's a diagnosis that shows up or a statement from a professional that seems like it's very limiting for a person. Silence, this is often, I find, critical when you really don't know what to do, or you think that you don't have the skills in that moment. You can just be quiet. And I find that works best. When you need to, you can also summarize things. So evaluating what you've received in terms of information and just understanding and rephrasing it back to say that you understand everything and that that person may understand it as well is very helpful. And often if you need to, you can always say I statements like, I understand you feel upset because what you just heard really makes you feel down, or makes you feel like you have no hope. Well, we have hope. We have this, and then you can start to, redirect that. Validating that person's feelings. Wow, I can't tell you the number of times where I've spoken to, especially women who have had significant trauma in their lives, and they have come back and said, what you have done and the work that you do validates my experience. Or somewhere when someone says, what you do or what you're able to share with me validates my experience. So you sharing research or knowledge with people that they may not be aware of actually helps show them that what they're experiencing is very normal and it's understandable and that they can cope with someone on their side. Okay, so this is another nice topic is when you disagree with someone. And I know this happens a lot, and especially when we're talking about medical sequelae, it can affect many people. So when you're actually disagreeing with someone, you can acknowledge oftentimes the impact of or the importance of the past. So sometimes the past has had a role in that person's life. For example, I had that surgery and it really disturbed my gut and my bacteria and my overall health. I've had, ulcers since I had that surgery. Okay, so there's an issue there. That person has made a connection between a surgery in the past and their current state. And now where do we go from here? Can we resolve this, or are there alternatives, or is there something else we haven't looked at? So just acknowledging the past is very important, because oftentimes you can allow that to help push that person over the hump to get to the next stage of their treatment or their actual prognosis. You can definitely come back to the present. And that's one thing that's important, is even when you disagree, you can say, okay, well, I understand we don't agree at this moment, but let's focus on the present. And that's a great phrase to just underline, keep handy. Let's focus on what's in front of us right now. We're not going to tackle X, Y, and Z. I had recently an advocate role with someone who happens to have a list of 20 different conditions, medical health conditions, everything from bipolar to high blood pressure to, obesity to edema to everything. It's a whole list of things. Well, that doctor that spoke to them said, well, you really need to focus on your immediate problems. Let's look at what's immediately bothering you and go from there, right? So we don't want to generalize. That's the next point here, where we just make sure that we don't condition everyone to believe certain things about the medical establishment, or maybe a particular institution or a medical franchise, or whoever it is, or profession. We want to make sure that we are open-minded to everything. We often want to listen. Obviously, we want to be kind and compassionate and caring, especially as we do this. Okay, so this is my favorite segment of the night for what I'll be sharing with you tonight, which is where I get to involve some of my kids. And what's really nice is that we just want to make sure we want to kind of go through this so you understand what the different types of personalities are. So we have aggressor, contemplator, mediator, and socializer. And what does this mean? The first type is an aggressor. And so an aggressor is someone like my middle child, Mateusz. He's super cute. He often asks what? And what their major fear is their biggest fear is losing control. So when they lose control, that's the biggest issue that will aggress them, and it'll make them lose kind of their sense of what's happening. These are the types of people that are often competitive, they're goal-oriented, they're demanding, they're blunt, and they're very direct in their communication, and they make quick decisions. Just for your own sake, my son, he's only 2 years old, but he's super cute, and he likes to make sure that he gets what he wants, and that's the type of aggressor he is. So moving on. The tips for communicating with this type of person is you have to be factual and accurate. We don't want to exaggerate. We don't want to come up with lofty ideas. Just be right to the point. We want to be straightforward. Ask very tight.
So you don't want to say you're going to the park, but not go to the park?
That's right. That's right. We might go to the backyard. Okay. So the park became the backyard now. Even if it's just 5 minutes, we got to go there. We went to the front. So we want to be straightforward. We want to make sure we ask challenging questions. So we know that they can handle a lot, because these are strong-willed people, but we don't want to tiptoe around them as well. Okay. And we want to make sure we use simple language, but delicate enough that makes them feel that we're educating them about the situation. You want to also have structured conversations with tasks and goals for making decisions and achieving objections. So you want to have some structure, okay, that we're going to have a plan. We're doing this with a purpose. You want to ensure that you have conversations in a timely fashion, but don't rush. This is important because they feel that things are going to go smoothly, but they're going to have a certain, there's a rhythm to it. And make sure you're standing your ground. Be strong and confident. You want to make sure that with an aggressor, you don't get pushed around, because then they'll notice they can push you around, and then that becomes an infringement on your relationship as well. And often use indisputable I messages rather than the judgmental you messages. So for example, I feel that you understand the situation to be an infringement on your rights, instead of you are taking this to the wrong extent. Okay. Remember that you have, or you do not need to have to agree. And that's fine. You won't always agree, and that's perfectly fine. And make sure you keep them active in the decision-making process because it involves them. It's important to them. And give them guides that they can follow and manage on their own. The next person is a contemplator. This is a person like my other son, Noah. He asks why questions. Why? Their biggest fear is criticism of their work or their ideas. So for example, if you target them or what they've just created, like a masterpiece, they're going to take that personally. And these individuals are meticulous. They're very introverted. They often will just stand back and look around and kind of assess a situation independently before they engage in something. They're detail oriented. They can be perfectionists, and they're suspicious of others. They may answer a question with another question and just go with it. Contemplators are good problem solvers, and they're very clever. Some tips for when you're communicating and you're dealing with people who are contemplators are to lay out the problems in a detailed and orderly manner. Be truthful and forthright in your conversation. Give breathing space before you expect a response, and ask them what they're thinking and feeling. You can show sympathy when they share concerns and worries, and try to bring a big picture view to the discussion. So let's see what the overall objective is here, because they'll appreciate that. And often use humor to bring them out of themselves and their worries, because again, they're often their ideas. You want to bring them back to kind of our human-based level. Speaking in a way that shows your appreciation and affirmation. And of course, you know, you can kill with kindness, as they say, but we don't want to kill anybody. So we're just saying be kind all the time, and just simply be sweet and be appreciative of what you're being able to bring. Okay, mediator. So these are people like my daughter. I have one daughter. I have 3 sons. My daughter is the firstborn. Like Alex, she had a child who was female first. I have a young daughter. She's only 5, but she's the first child, and she's our mediator. She asks the questions of how for everything. Her biggest fear is loss of stability. And that's because they're often rooted as a premier leader in their organization or in their families or in their networks. These individuals are calm, they're level-headed, and they're great listeners. They're often, they like to contemplate questions. You will not get an actual answer immediately. You might get it in a few days. They dislike conflict, so they will internalize and they will tolerate it. So they're people pleasers most often. And they try to keep everyone happy, often at the expense of their own happiness. And the tips for the person who is a mediator to speak to is to show appreciation before difficult discussions. So always start with, like, I call it the sandwich. Hey, I really love that you put this beautiful piece together. And then you come in with a difficult discussion, and then you finish off with a positive affirmation. So it's kind of like that sandwich, okay? Let them take charge of planning. Put the discussion on the calendar, say, we're going to talk about this. So we're going to say, think, plan, and think some more. That's pretty much what that person is like. And then combine the facts and the feelings together, because they'll appreciate that more. Give them space to express their opinions before you give your own take on that situation, and avoid criticism and nagging. You can also remind them the rules for the conversation from before you actually begin. So when you walk into an appointment with someone who's a mediator, you want to make sure that you outline kind of what the plan is, what the strategy is before you actually engage with the doctor or the medical professional. And that way you can be prepared and you can take their time in your time as well. The next segment is the socializer. Socializer is like my youngest. He's only 8 months. My baby, his name is Tobias. He's called the office, what's that? Yeah.
The office baby.
Thank you. The office baby. That's right. He comes to our office with us, and he is very involved, and everyone likes him, and they like to pick him up and carry him. And he is the person who asks who's the biggest question, excuse me. Sorry. And they are often saying, why, who's around, what's happening. And their biggest fear is because they're worried about social rejection. These individuals are charismatic, they're enthusiastic, they're persuasive, talkative, and social. They're smiling, they're always in a good mood. They often have they're also very visual and creative. And the socializers do not keep track of time very well. So you can lose track of time. And that makes sense, because our office baby will take up a lot of our time sometimes. they enjoy being the center of attention, which makes a lot of sense. And then the tips for them is to begin with a compliment, and you just say, I really like what you're wearing today. That's a great tip. And gently redirecting the conversation from any tangents, being spontaneous. They appreciate that. It brings them life, and they love that. Being starting with the feelings, focusing on the big picture, save details for later. We'll avoid all that, and we'll talk about the big picture first. Staying positive, talk about what can go right in a situation. Let's work together on these plans and moving forward together in a quickly effective way. Okay, that's how you would deal often with the socializer. All right.
There we go. It's interesting because Adrian in our office, his wife works at a pharmacy, and she often talks about Tobias because Adrian's in our office. She comes around, and the ladies in that pharmacy are always saying to her, "How come you guys have an office baby there? We don't." So obviously speaking, the office baby becomes a very important part of the office. Anyway, advocacy at the doctor's office. So one thing I'm going to say is that a lot of this seems pretty, because you remember when you're advocating for someone, like there might be issues you get into. That's absolutely correct. Most often, why are we advocating? We're helping that person. We're also creating community for that person. We're showing the healthcare system that this person has people around them who appreciate them, who are there with them. So you're being that caregiver, that one who cares about them, who is in their corner. So a lot of what we're talking about, these are issues that come up. So this is just a training manual to give you some response to these things, okay? So you can think it through in those situations. But most often you will not be faced with a lot of these issues. Nonetheless, it's not an effective training manual if you haven't looked at these issues. So advocacy at the doctor's office is very important because obviously speaking, it is there that often, difficult decisions are having to be made, or someone, as an example, what I was saying in other presentations I was making. So let's say someone has some back issues and they have back pain and things, and now it has gone into their shoulder. They're having back pain and shoulder pain. And when you're visiting the physician, the doctor doesn't know that this person's pain has now moved to their shoulder, and there might be other things going on. So obviously speaking, you are going to communicate with that person ahead of time. You're going to navigate the healthcare system with them to help them find what they need. So you can help a person understand and navigate through the healthcare system. In the case of my son, Peter, my wife has been doing that pretty much all of his life. Just by being present, you can affect what is being said to whom and how that information is being understood. But you're also following and sort of taking notes. Now, we had a woman on last night with our training session who's done advocacy, and she said that she likes to record. She asked the doctor always, "Can I record this conversation?" And the reason is if you're advocating for someone who might be quite elderly and have some memory issues, obviously speaking, you want to be able to go back to it and make sure the person you're advocating for knows exactly what was being said. You can listen and ask questions and be supportive when your client feels anxious or confused. So you're helping them through these situations. As an advocate, you help the medical professional understand the complete health situation of your client. So obviously what are you doing? You're speaking to them first. If there's been new issues, maybe the person you're advocating for is having a difficult time expressing themselves. You're therefore going to help express them. You're keeping track of old and new symptoms, problems with current treatments, or significant changes. So obviously speaking, the physician, the doctor might not have seen this person in several months, and now something new has developed, as I said, so obviously you're going to help that person express that. You're managing current medications and making sure all medications and supplements are reviewed on a regular basis. It's important to go to the doctor and have a list of the medications with you. Why do we have a list of the medications? Because it's possible that over the years, the medications that have been prescribed, it's possible these things have accumulated, and maybe something isn't as effective for that person anymore, or maybe now there's certain medications that they're receiving that were changed, etc. And then now there's a contraindication, and they wouldn't know it unless you actually are being a good advocate and bring in that list with them, and they look at it, they say, "Oh, well, maybe we should try changing this," right? Go together to appointments to take notes, bring up important questions for the doctor, ensuring that critical details are not overlooked. Okay, so it's important that you've talked to the person ahead of time and you're making sure that those things are not being missed. That's important to your client, okay? Once again, to be a healthcare advocate, you require the written permission of your client. Oh, you said that earlier, say it again. There's no question about this. It's very important, okay? It's in the booklet. Discuss with the person what the expectations that he or she may have as their advocate. Ensure that they're willing, able, and comfortable with doing these tasks before you agree to become their advocate. So obviously speaking, there might be some issues that you wouldn't be comfortable with, and you should have that discussion ahead of time. To speak on behalf of another person, you must receive consent. A written permission is necessary. Once you both agree that they will, and that's in Appendix A, that you will be that person's advocate, complete the patient advocate agreement. Before your client's appointment, ask them about how they have been feeling and if anything is bothering them. So what you're doing is you're helping them express themselves before the physician by communicating ahead of time, getting the information. You may get more information when they are relaxed and have time to think. Sometimes you just spend time with them, visit them, talk to them before that appointment. Rather than if you're in the doctor's office being questioned, someone might have stress and they might not remember everything. Asking a few separate times over in a couple of weeks might help collect more information. So you're revisiting that person and you're collecting information for them about what's going on. And if there's some new issue coming up, you're making sure you note that. And if there aren't any new issues, then you're talking to them about, has there been, let's say someone did receive a prescription for something that they were experiencing, and they haven't really had a good experience with their health after that prescription. I'm not sure if it was that drug that's causing the issue or not, but I think these are things to discuss, right? Patient advocate agreement, well, that's in your booklet, okay? Before you go, you better know the time of day of the appointment, okay? It's very important that you know that time of day, that you go with the person. The person may be better able to participate in the doctor's visit in the morning. So if they're better in the morning, try and help make sure they have a morning visit. But before the activities of the day or in the afternoon, there should be this person should be relaxed. They should have slept that night before, or that sort of thing. Okay, you and your client should be well informed about their healthcare needs and understand the condition, treatments, any terms that the doctor may use. So that means you have to clarify these things. As you're speaking to the physician or as the physician speaking to your client, you clarify things, you ask questions in a very polite manner. Okay, these points will help you maintain. So review the following with your client. These points will help you maintain positive, productive relations with your client's medical providers. As an advocate, you and your client are partners. Doctors should listen to your concerns and answer your questions so you feel comfortable. The doctor should be sure that your client understands and feels comfortable with the decisions regarding their health, okay? So you're helping make sure that everyone is communicating effectively, and if your client is uncomfortable with something, you know that and you're dealing with that ahead of time. What are the person's concerns? Is it about physical symptoms like pain or shortness of breath or feelings such as being sad or worried? Is there signs that someone's depressed? You're not a physician, you're not trying to be a physician, you're not trying to be a psychiatrist or a psychologist, but obviously you want to communicate with them and say, well, they're concerned about this issue right now, okay? Maybe the person's not sleeping at all. Maybe they're just not sleeping. They're having real issues. They've got certain pain and they're not sleeping. Is the person seeking information about medication side effects? As I mentioned earlier, someone might have had a new prescription and it didn't seem to be working for them, or they're having certain reactions that are different than the past. Once again, I'm not the doctor, I'm not a pharmacist, so I don't know, but obviously these are questions that should be asked, okay? Does the person want to report new symptoms or concerns? So obviously by communicating with them, we're going to identify that. Generally discuss how to talk with a doctor about sensitive issues. There are many sensitive issues, okay? He or she might prefer that you do not talk to the doctor at all, that your presence may be enough support. That's very important. I know it might be difficult, but sometimes the best thing you can do when you're visiting somebody, and in this case, the best thing you can do sometimes when you're an advocate, is simply to be there, to listen, and to take notes. That might be the best thing you can do, okay? Find out if the person wants you to have time alone with the doctor. Maybe not, maybe, right? Maybe the doctor actually wants, because if you've discussed these things with, let's say you've been with this person for a while as their advocate, the doctor might wish to talk to you then. But remember, you're talking to them about their issues. It's not about your issues, okay? Good preparation involves being specific as possible about what you want to achieve, and if possible, what specific actions should occur, okay? So let's say you're not comfortable with the medication you're receiving. It seems to have caused you, like you had certain symptoms beforehand. Now you're taking this medication. Now you're having other symptoms, which seems to be, very difficult, and it doesn't seem to be right. Obviously speaking, you want that to be examined, okay? What are your list of symptoms? List of prescriptions. Bring a list of medicines he or she uses, or put them in a bag to take with you. This includes herbal remedies. Well, believe it or not, herbal remedies might be reacting to something. Creams, supplements, and any over-the-counter medicines. Test results. Gather information. So obviously, if there's certain tests that have been done and the information that patient has, you might be taking care of that for them. Remember, it's for them, not for you. Okay. Are there any drug allergies? These are important information to have and for the physician to have. What I also talk about is, maybe it's later on anyway, is if you're after the visit, we're going to get to after the visit later. Bring this information along with the list of questions and topics that you and your client want to discuss. So obviously you've talked about it ahead of time and you have a few lists of things you want to discuss. That's important. Have a notebook. Okay. Now remember, taking notes at each appointment and this, what's so important about this is you're dealing with someone's personal information. It is not your information. Why would you be taking notes? You're taking notes, why? To help that person know what's being discussed and everything, and that there's a recording of that. So if the doctor is saying, well, there seems to be new problems coming along and it might be something like this, and you're writing down what it might be, we don't know what it is, but then when the person says, well, did the doctor say something about these symptoms? Yes, the doctor said it might be this. Okay, now you have that. Record the date and time of every meeting and every telephone call. Record your discussions. Okay, write the speaker's name, title or position, phone number, date, time. Why are we doing this? Because it might be important that you had a conversation on November 20th and now you're visiting the doctor on December 10th. Okay, that's a time frame. It's an important time frame. Sometimes people will say or promise things verbally that they do not act on. So now you have a written record. Someone might say, well, we'll look at your, we're going to examine your medications that you're taking. We're going to look at that. And so I'll get back to you in 4 days or 5 days. Maybe they never get back to you. Okay. Keep a written file of responses and other documents. It is important to keep track of these in case you need them for the future. Now, I mentioned about my son Peter. My wife kept all of the communications with the doctors, with the experts, with the people at the Children's Center, with the teachers, with any assessments he had. She kept it all. And when he graduated from high school, she had this booklet that was like yay thick. I mean, it was massively thick. But any kind of question they had about a previous assessment he had or something they had done or whatever, she had it right there. And so she could refer to it. Yes, I have it here. It was from something. Now that means she was very organized. I'm not suggesting that you be that organized because maybe that's not your characteristic or type, but you have to keep certain things for somebody. And remember, it's not yours, it's theirs. You write down your questions. If you have, if you or your client become too upset to talk, you can hand the written list over to the doctor to read. Maybe that's another communication style. Maybe you just disagree and you hand them the questions and then they can deal with it from that point of view. The day of the appointment, call the office to see if the doctor's in. I don't know if you can actually do that. Honestly, today it's very hard to get appointments as it is. But nonetheless, call the office to see if the doctor's on time with his or her appointments. Inform the receptionist that you'll be at the appointment to be a note taker or to be their advocate. Bring a bottle of water, a magazine, or something to read for your and something for your client also in case there's unexpected delay. I know there's never delays at the doctor's office, but nonetheless, bring a list of medicines he or she has used to put them in a bag or take with you. That includes prescriptions as well as herbal remedies. I've already gone through that. Be on time for every appointment. Don't be late. Introduce yourself to any new doctors or nurses. Respect your client's privacy. Absolutely. Go to the waiting room if the person requires a physical examination. Respect their privacy. Let the doctor know if your client has any hearing or vision problems that make it hard to communicate with them. Be aware of your body language. Sit up straight. Look the doctor in the eye. Take notes. Be kind. Now, always make sure they know what you're doing. Like, obviously speaking, like, we're not trying to cause a problem here, believe me, okay? You be kind, even if the doctor's not kind. Maybe the doctor's had a bad day. Maybe the doctor doesn't like somebody. It's possible. I'm not saying they're all human. Remember that. If you feel upset, take a breath. Count to 10. Then you can express yourself once you've calmed down, right? Calm down, be calm. When you finish the appointment at the end, ask questions and bring up concerns, okay? Listen and do not move on your do not move onto your next thought or before the doctor's finished speaking. Don't interrupt them. Once they are finished speaking, do not be intimidated by the doctor or any other healthcare professional. You are their advocate. A doctor has an important education. They have an important role in the culture, but they're not a god. They are another human being, and you treat them with respect. But we communicate with them, and we shouldn't be afraid to. Let the doctor know of any changes in your client's health since the last visit. Well, sorry, I missed. If your client wants to speak when the doctor asks you a question, turn towards him or her and suggest that he or she answer. Don't speak for somebody else. If they want to speak, of course, have them speak. Keep the discussion focused on problem solving. Have the following questions answered. How serious is the condition? Let's not get all upset if it's not that serious a condition. How will it impact your client's daily life? Is it chronic? Will it worsen over time, or will it go away with treatment? Is there a treatment, right? What causes the condition? What are the signs and symptoms to watch for? Is it contagious? Don't be embarrassed about asking questions, okay? So being a good advocate requires the ability to ask questions, always respectfully, of course. Ask questions to make sure you understand the doctor's instructions and explanations. Repeat in your own words what the doctor said, just to make sure you understand. Most doctors today are actually pretty good at speaking in a layperson's language, but not all of them. Nonetheless, it's possible that the person you're representing is having a hard time understanding what's being said to them. They may, or maybe they're having, because of age, they might have a difficulty with cognitive awareness at this point. So you're helping them in that case, okay? If a new medication is prescribed, how effective is this treatment? Ask about it. How will the medication that your client's taking interact in their body? Now, obviously, you've brought the list of medications with you. How is the medication taken? How long will the client need to take it? These are all important questions. How much will it cost? Does the client's insurance, or provincial in this case, or private, cover the cost? What are the side effects? It's all important. Will this affect your client's ability to function independently? How long will it take the medication to work? Are there any alternative treatments? What if they decide not to take the medication? It's important. Read up on any new medications that the doctor prescribes. Well, often the doctor will provide, if you ask, they'll provide information about that medication. Usually a doctor or the nurse practitioner, they can print up from a computer information about that medication. It's good to have that information, especially if it's a type of a treatment for a condition. Tests, what tests are they recommending? They might be recommending that a certain test happens, right? And how accurate is the test? What is the test trying to accomplish is what we're saying. How will that client get the results? And then what happens? So we're trying to find out what is the direction of things? What's happening, okay, for your client? Questions continue. Okay, well, we asked the doctor whether he or she has any recommendations with respect to lifestyle factors, including diet, stress management, exercise. I would not advise them to do what I'm doing, which is, running 10 to 15 kilometers. No, I do that all the time. But it can be difficult. I wouldn't advise someone to do that. Inquire about services that may be offered that may be beneficial to the person. Diet, Meals on Wheels, outing. The doctor may be able to refer the person to a community counselor. There's other things too, though. When it refers to Meals on Wheels, but there might be also certain services. Someone might need help with getting bathing or other things in their home. And the physician then would then say, yes, I agree. And in this person's condition, they should have somebody coming a few hours a week to provide certain services. Write down the instructions given by the doctor and have him or her review it before you leave. Obviously, you don't want to get it wrong, right? We don't want to get it wrong. Do not have your client sign any consent form until he or she understands it. It's nothing personal. They have the right to know exactly what it's saying, and they may have a cognitive issue. They might be having a difficulty understanding it. You might have to explain it 2 or 3 times. That's fine, or the doctor might, or the nurse practitioner might have to explain it again. Ask for information sheets. As I say, that's available today. It's actually quite available. Ask when your client should next contact the doctor, or monitor the progress and get results. Determine if the treatment is working. To determine if the treatment is working. So if they're starting a new treatment, say, should we see you again in a month? 6 weeks, whatever it is, right? And then you would then ask the doctor to do a full medication review at least once a year. I always mention that sometimes it's a good idea when you're helping somebody with their medications that you also might ask a pharmacist for a medication review, because pharmacists are very much experts when it comes to how medications are and how they interact. Okay, and they also know the alternatives. I wouldn't have any idea what the alternatives are to a certain drug, whereas a pharmacist would know it. I'm not saying that drug is better for that person. I wouldn't know, but sometimes it's good to know that there are options. This is to ensure that the medications are working well together, being taken at the right time and in the right combinations, and to check if all medications are still needed. After the visit, make follow-up appointments right away. If necessary, help your client fill any prescriptions. Ask the pharmacist for information on side effects of the medication. As I just mentioned, the pharmacists are experts. They may also have information sheets, and discuss with your client how the meeting and visit went. If they felt that everything was dealt with properly. Was the visit a good experience? What could have been done to make it better? Maybe the person doesn't want me speaking. That's fine. Maybe they just want me there, okay? Did I, the advocate, ask too many questions? Maybe I did. Maybe I was too talkative, okay? Maybe I wasn't talkative enough. Did I let my client speak up for him or herself? Well, remember, you're representing them. You're not representing yourself. Did they feel that they had enough time to ask the doctor questions, right? Remember, successful interaction with the healthcare system requires persistence, that you continue to focus on this, okay? And I believe I am moving on. Am I not moving on to Kathy?
Yep. Thank you so much, Alex. So this is from Dr. John White, which is the Chief Medical Officer of WebMD. He says the healthcare system can be very challenging to navigate. There are a lot of regulations that can impact your access to care, and they can be confusing. Sometimes your technique does not work the first time. So you need to keep at it when it comes to accessing certain services, and you need to speak up. There is also an interesting dynamic with older adults when it comes to healthcare. They often say they do not want to bother their doctor, or they want to be a good patient. We have to help them understand that being a good patient or a good advocate for someone else means getting what you need to make sure you get quality care. So this is very key, and this is from a doctor who knows the system. The next point where we want to make sure that we stress here is that doctor's appointments during this type of timing with coronavirus and other infectious diseases, it might be different depending on the type of time of the season and in the year. So here's some things to expect. Doctors and staff will wear personal protective equipment like masks and gloves. They might have disinfectants, sanitizing regularly. Their offices are set up for social distancing. You might check in by phone, perhaps, or even online. Some offices were doing this over COVID, that you check in remotely and then you'd enter in afterwards. Wait in your car instead of at the waiting room, and be the only patient in the office. You may have to answer questions based on the possible contact with infected individuals, and you might need to wear a mask or a visor. To limit your risk of getting sick, please take care and precaution as you need, and keep your hands away from your face, and wash your hands often and well, because that is something that will help prevent disease. Advocating at the office and at the hospital, sorry. So this is when you are, as an advocate, you may find yourself advocating for someone who is in the hospital, and your primary role may be to visit that person. You can always observe and take in anything that may be happening and advocate for what they would like based on prior discussions. You may also be reminding personnel or person in their life, just telling them what they want and what they need, and that way they feel they have what they need. You may need to inform a family member or their decision maker, if they have one, about a situation or treatment you have observed. So this is something to keep in mind, and also the notes and the taking of notes is very important here, because some things are going to happen, certain situations might get escalated, and you want to make sure that you have good solid notes on how you are involved in certain things. This also is very important for later on if something does go awry, or if there's a different shift in transfer of care. You want to make sure you have very detailed notes of everything that's happening. In many cases, the person you are advocating for will be fully aware and may not need you to speak on their behalf. However, Your presence should improve the psychological well-being of the patient, and that may speed up their recovery in time. In addition, there also may be resulting in better health care from doctors and nurses. Just simply by being there, you're making a big and positive impact for that person. When you're at the hospital, please try to visit as much as possible. I know oftentimes they try to dissuade you from visiting. Try to be more of a contrarian in that regard, because the more you visit, the better results you often will see with the care of that person. You want to make sure you are also monitoring the medication. So take notes of the medication that they're being given to make sure that it's the correct drug at the correct dose, given at the right time. Make sure that your client is getting the right levels of medication. They should not be in pain or over medicated. And you'll notice this because sometimes when people are over medicated, you know, they might be sedated and they may not have a certain response that they're normally used to. So you are also a person and a caregiver in that regard, that you are acknowledging and know how far they're being medicated. And if it's too much, then definitely make sure you are aware of that. Inform the hospital staff of any special needs of your client. And this again can come up with things like, for example, diet and restrictions and other things as well that you're aware of. Make sure your client is comfortable. If permitted, bring some skin moisturizer, lip balm, maybe a personal item like a blanket or a personal item or a family photo. That could be a book or magazine that will help that person be at ease even though they're not at home. Throughout their stay, you may wish to read aloud and use like a favorite book to read to them. Studies actually show that the median average rate of medication error or unintentional medication discrepancy was nearly 50% in adult and elderly patients after hospital discharge. Nearly 20% of adults and elderly patients in studies were reported to be affected by adverse drug events, ADEs, after hospital discharge. So this is critical and something very important, which was mentioned in the video we watched as well, that when a person is discharged, there's a discrepancy when it comes to what they're given in terms of medication and error. So be aware of that, okay? And keep care on that as well. When they are discharged, before they leave the hospital, make sure you understand how the medication regimen is different from your client's pre-hospital medications. Often doctors will come on staff or in their care that may bring on new medications will actually alter the course of their prognosis or overall treatment and health. You want to make sure that you understand all those things before hospitalization, during, and after, and how those medications can play out with each other and why the changes are being made. Sometimes there's, like we mentioned earlier, a medication may be only for a short period of time, and especially if if it affects someone adversely, they need to be notified how they can wean off that medication slowly as well. Studies show that. So we mentioned that as well. Yeah, it's good. Thank you so much. Dementia. When we are speaking about dementia, this is something that usually develops gradually and gets progressively worse. For someone, if they're in an unfamiliar hospital environment, they can be very disorienting and confusing. Hospitals can be noisy and are full of unfamiliar people, bright lights, and reflective services. So a person who has dementia or has that condition, they may not be feeling well. He or she will be touched and questioned by medical staff. So it's important that they often cannot or will not accurately report symptoms or pain if they have dementia, and they may not remember what happened or why they need to be in the hospital. So you might be reminding them on that as well. This can cause agitation, delirium, aggression, worsening of symptoms, and other challenging behaviors. The hospital stays can bring out these behaviors, so they can heighten that. As an advocate, you can help relieve these stressors. So if there's harsh lighting, you can actually ask them to be dimmed. You can ask them to be moved to a quieter area. You can bring a simple calming activity for your client to focus on and help them stay busy while they wait for treatment or tests. And then always take notes. If you notice expressions of pain or changes in their symptoms, so you can update doctors and nurses, because that's very important. The next point is if someone is suffering from delirium. It often happens suddenly and typically changes throughout the day. And if it's an older adult with no history of cognitive impairment, suddenly they start to have cognitive issues during or after hospitalization. And it's most likely not dementia. It may be delirium. People with delirium often have terrifying hallucinations, delusions, and are unable to think clearly or focus. In older hospital patients, these symptoms can be misdiagnosed as dementia. Some patients with delirium are agitated and combative, and others are sleepy and cannot pay attention. They may show symptoms of post-traumatic stress disorder, or it can also happen at any age, but delirium is more common in hospitalized persons older than the age of 65, excuse me. Research has linked delirium to longer hospital stays and greater risks of falling, and it also has the increased risk of developing dementia and an increased death rate. And oftentimes, if you experience at this moment large, doses of anti-anxiety drugs and narcotics are often given when this happens, and tranquilizers are used to actually treat anxiety. And these medications, we'll talk about that as well after, but they're known to trigger or exacerbate the problem. The patients are in intensive care. They are often heavily sedated, and the patient is often he or she can be placed on a ventilator. And as we know, ventilators are tricky because, their success rate in terms of, long term is very, is actually critical. So the environment often is very busy, noisy, and brightly lit. So sleep is constantly interrupted and the staff keeps changing. And the issue here is, you want to leave these symptoms. So there's some, warning signs. The warning signs often are that there's an acute change in concentration for the patient. There's inattention. So they might not be able to, they'll be distracted easily. There's a disordered thinking, disordered speech. There's an excess in drowsiness, disorientation, inappropriate behavior, unexplained difficulty with feeding oneself, and unexplained difficulty with mobility, moving around, or movement if a person is immobile. What can you do? You can speak to the doctor and minimize the amount of medication. You can notice these negative side effects and ask them to make changes immediately. Ask staff to dim the lights and turn down the noisy machines if that's possible. And also you can keep the door closed to make sure that you can reduce the noise. Also, if they have, a divider, you can try to pull, the curtains and try to create a calm space or environment, dimming the lights and all of that. Keep your client hydrated. That's very important, very key. And that will affect their medications and how they're absorbed as well. Stay with your clients so they have a familiar face. Just your presence again, coming back to that is really important. Arranging for your client to have a maximum amount of undisturbed sleep. You can be protective of that as well and ask the doctors and nurses if their visits can be coordinated or less frequent. So they're grouped together so they give them longer times to sleep without any harm to obviously the patient's health. And have a large print clock and a calendar visible so your client can see the time and date. So that way they have an orientation as well. When it comes to family photos, they can bring that along and they can have their family there at least to have that as an orientation as well of who are their families. And whenever possible, ask your client to take short walks or practice therapy exercises. This is also very important for their physical well-being so that they don't have any pressure sores or any other ailments. And a study by Harvard researchers found that a variety of non-drug interventions for delirium, making sure patients' sleep-wake cycles were preserved, that they had their eyeglasses and hearing aids, that they had, that they were not hydrated, reducing. And they actually reduced their delirium by 53%. This is fantastic. As a result, falls also patients was reduced by 62%. So this is very important. And there's actually a great questionnaire at the end in your manual that you can look at if you need to, if you want more further detail on this. So finally off, we just wanted to suggest, these things are some things for you to consider as you go forth in your advocacy journey. Some suggestions for you is to start a support group. We've already mentioned this with our Being With program, but we will consider doing the same potentially with the advocacy training group, which is that you can start becoming advocates, and as you go on into your experiences and your groups and your patients and clients, you actually can meet together and create little communities where you can support one another, and that's very good and valuable for your further benefit and understanding. Also, too, we wanted just to make a note of this to talk about burnout, because this came up on our discussion yesterday. So I added it here as well. It's very important to be aware of when you're doing too much. And as Alex says, burning a candle at two ends, right? So you can avoid that by involving yourself in other activities, giving yourself breaks, and often it can come down to saying no as well to certain obligations. So that's very important, and keeping time for yourself. Keeping a journal is very important here because that will help you guide yourself and evaluate yourself how you progress, and you can evaluate your appointments and how it goes, and give yourself notes on how you can improve better on your next time. And thinking of opportunities for enriching your experience with the client, the person that you're advocating for, and so that you can actually understand more of how things work and how you can better both the experience for them and for yourself. And if you have any concerns or have any questions, you can always speak to your client. You can also, refer back to your supervisor if you're a part of a group already that's organized around this initiative and the effort that you're doing. Or you can also reach out to us. We have a helpline. We have these great little cards, and we've shared these with people. So if you do ever need help, that's a helpline that's available 24/7. It's advice, help, and support regarding euthanasia-assisted suicide prevention and end of life treatment issues, and it's confidential, it's free. So we can share these with you, and we can share these with your contacts as well. If you have any of that shows up, you need that help or extra support. And we also have an office line, which is here listed. You can contact us there on any time. This is really important work. So we just want to acknowledge each of you for being here. Thank you for being the first group. And I would love to hear back from you all, and for you to share your experiences as you go out on your journeys and being health advocates. So thank you for being here tonight. If you'd like to stay in touch with us, at Compassion Community Care and at EPC, Alex and I would love to hear from you. You can reach us on our final slide, which is in London. You can call us, email, you can reach out on our website. We're going to have these events on an ongoing basis. So we'll encourage you to share this with other people you know. They can become advocates as well, and share it with your wider network so they know that we exist and the great work that we're doing. And of course, all these resources are available to you. So if you decide you wanted a copy of either of the books, we have a short little version that we provide you along with the actual manual that we shared tonight with all the content in it. So you didn't have to take notes tonight. You can just keep the book and keep it handy. We can send that to you via mail. Just send us an email, or you can write in the chat, and we'll send that your way. And there is no cost to this great resource, but we simply ask, if you can, for tonight, for these sessions, maybe you can consider giving us a donation. And we do offer tax receipts at the end of the year and the following year. So we'll send those out to you as well. So thank you so much for your support, everyone. And thank you, Alex.
So I was going to say that we're not trying to scare people, because some of this seems pretty scary, because the primary thing about being an advocate is to be with somebody who has specific needs and to help them in the fact that you're helping them receive the care that they need. Obviously, it can get more difficult. So like the visiting training program, when we go into issues around elder abuse and things like that, we're not talking about elder abuse because we're absolutely expecting you to be visiting someone who's experiencing elder abuse. Is because if you do bump into someone who's experiencing elder abuse, you need to know what you need to know how to react to that and what to do about that. But the fact of it is that most people who are going to be involved in this sort of thing, advocacy, it's someone that we're hoping you're going to be involved in, whether it be a family member or a friend. It could be someone from your church community that someone you've known for many years. Now they've become very elderly, or they've developed health problems. This is the kind of thing that can be a big difference in someone's life. I also say to people, like, you should look for an advocate. So someone let's say in your church group might say, I think there's someone who's willing to be my advocate. And the reason I say that is because when you become older or you have significant health problems, I'm not trying to be judgmental, but certain people don't look at you the same way anymore as they did when you were younger and healthy and everything. And so the fact of it is to be seen as who we know you are. It's someone who needs that care, who's part of a community, who deserves the care they need, it's important to have an advocate. I'm going to say another thing, like I mentioned about my son Peter. Well, what about if you're someone who needs certain supports? So you need someone coming in the home so many hours a week to help you maybe with a bath, help you with some cleaning things, help you with whatever. Well, you know, the doctor actually, or the nurse practitioner, they're the gatekeepers of these services in some ways, because obviously speaking, if you visited the doctor and the doctor agrees that you have lost certain levels of mobility and you need that type of a support, the doctor will then say to the community services, yes, you should be contacting Mrs. So-and-so. But you know, as the advocate, you will be helping that person to explain to the physician why you need that, why it's very important that you aren't getting around like you once did, etc. So you become a real help for that person, and you make a big difference in their life. Now, obviously, we've gone through a lot of materials and information, and maybe in some ways too much. We're not claiming we know everything about this. What we're claiming, though, is that this is an effective information to help you make a difference in other people's lives, and that's what's important. And if anybody has any questions, we'd be happy to take them. Like I know that Kathy's been looking at the chat line. Is there any questions on the chat line, Kathy?
Yep. There's a comment here, if I may read this out to you, Alex, from Charlie. I have touched into many situations of patients being inappropriately medicated by psychiatrists and other physicians. In one situation, I've accompanied my relative by marriage to a psychiatry appointment to ask the psychiatrist to wean him off benzodiazepines, as he has been prescribed them. Sorry about that pronunciation. Them for 1 year. The pharmaceutical manufacturer recommends only short-term use of 3 to 4 weeks. It is very difficult and inconvenient to wean a patient off of these meds as they are so addictive. His psychiatrist and nurse jointly and lightly discounted my concerns and progressed my relative through their program at Hope Center, the Greta and Robert H.N. Ho Psychiatry Education Center, and gave him ECT several times. He is now dead. I wonder what else I could have done for my relative in that situation, or what I might be able to do for others in like situations.
What I can say is these are not easy questions, but the fact of it is that when that was occurring, if you had someone to talk to, they might have been able to help you recognize, because obviously things went the wrong way. Like we're getting calls regularly from people who have real concerns about what happened to their loved ones. Sometimes their loved ones are still alive, and sometimes their loved ones have passed away. So sometimes they're calling us because they're upset about what happened. And sometimes they're calling us because they're upset by what is happening, or they feel that something's happening. And it's important, like, and I'll say most often it's important because you have an opportunity to discuss it with somebody who, and if we don't have experience in that area whatsoever, then obviously we will contact somebody who has some experience in that area, because we're trying to make sure that you get the support you need. And obviously speaking, no one here is claiming that we know everything, because we don't. But, you know, there's no easy answers to these situations, but you have to, you know, if you had the opportunity to communicate with someone earlier, it might have been a different outcome. I can't say, obviously, because what's happened has happened. Someone says here, isn't an undiagnosed UTI also sometimes the reason for a patient appearing to have dementia suddenly? And that's correct. Yes, certainly infections make a big difference, absolutely. And they, you know, the best way to deal with that is to test for these infections. I had an article I published way back in 2016 where, and it's just a fact, the nephew was all upset that his aunt had died by euthanasia because she had had a bladder infection. And she had no medical conditions causing her death. She didn't have cancer. She didn't have any of these things. She had no diagnosed condition, but she was really going through a really bad situation. She had had a bladder infection that she seemed to be better. She had antibiotics. She seemed to be better. And then she went into this big downturn. That woman actually sadly was a member of Dying with Dignity. And she then was given euthanasia. And he said, well, there was no diagnosis. There was nothing. So, you know, these kind of things are sad that happen. Yes, I've heard of the okay. Thank you for being a nurse. Being a nurse, I'm impressed how well you have covered this very important information. Well, as I say, this is actually our first session, and we are looking for feedback too, because we're wanting to make sure that we do a good job. It has been recorded. So yes, just like the visiting workshops were recorded. Is there anything else you wanted to say, Kathy? Someone can actually unmute themselves if they have a question. Yeah.
There's also a mention of, can they share this with others? The recording will be ready, and when it's finalized, we can send it to you and you can share it definitely with others.
I
And
would rather they join a future session, actually.
yes,
I would rather that, yeah.
definitely. And then also there's a question, do each of the provinces have a Bill of Rights?
I can't exactly answer that, to tell you the truth. I'd have to Google that to find out if every province has one. Obviously, Ontario had one in 2007, and it's quite complete. So, you know, when you look through it, you realize that it covers most of the issues we were concerned about. But that doesn't mean that every province has a Bill of Rights. That's a very good question. I don't know.
Someone sent the one from BC. It's in the link here. So if you are interested in BC, we can send that to you as well. It's copied in there. Also, someone asked, what other agreement forms do you sell, like the $10 one? Thank you.
Yeah, as I said, we have the power of attorney for the life protecting power of attorney for personal care. There's a BC version of it. There's a Canadian version of it. We also have a version for one for 46 different states in the US, because in the US, 46 states fit one type of a document and the other 4 states are different. So then we've got 4 different documents for those other 4 states. So yes, we also have the documents for the US. But yes, in Canada, BC is different. I don't know if you're from BC. You guys are different, okay? Quebec's also different, I have to say. Quebec's also different. I was registered to attend last night's Being With session, but was unable to do so. Am I able to access the recording? The recordings from previous sessions are available, Linda. The Being With session will be held again. We've been doing them about once a month approximately, and the number of people who participate has varied. You know, we've had some sessions with a very large number, like almost 100, and other sessions like this week was around 20. We had more than that register, but we had about 20 show up for the Tuesday, Wednesday. So just like tonight, we were up to 34 at one point, but we had a lot more than that register. So
yes,
but they can come on to a next set. I would prefer people not watching the video who've not participated. I'd rather they come to a live session, and I think they'd get more out of it that way. I do, especially as this was the first one we did. I'm assuming the next one will be better. If you looked at some of our earlier Being With sessions, they weren't quite as good as the last one was last night. So, you know.
Yeah. Any other questions? Oh, sorry, go ahead.
No, go ahead. Yeah.
There's a few more comments here, so I'll just go through them quickly. And the ones who have sent requests for copies of the book, I will mail them to you. If I don't already have your mailing address through your registration, I will look it up there. But if I don't, then please email us and I'll get that to you. Someone asked if you can have the PowerPoint because they want to share that with other groups.
The PowerPoint actually isn't special in this case. If you have the booklet and you go through it, you realize in this case the PowerPoint is pretty much similar to the booklet. It doesn't go into the in depth, but if you have the booklet, you actually have a lot better information than the PowerPoint. So
that's great. Yeah.
We didn't really exclude too much out of the PowerPoint, but I mean, there's more in the booklet.
Yes. I'll just read a comment here. With the demands on our healthcare, it is wonderful to see we can help our loved ones navigate challenges as an advocate. Many thanks and blessings to you both. I have a few people that I'll be sharing this with. Thank you so much for that. Yep. And I'll just make note of the people who are asking for copies and we'll get that out. Any questions from anyone in the group?
Okay.
Okay. Wonderful.
Thank you very much, everyone. If you have any questions, as you see the email there is on here, info@beingwith.org. Kathy's happy to communicate with you tomorrow or the next day. Well, the next day is Saturday, so maybe not the next day, next week. And if you have any questions, don't hesitate to contact her. We're encouraging people to get their groups involved with this. If you're part of a community group or a church group, to get them involved with this concept of being advocates for those in your community who are in need. All the information is actually somewhat overwhelming, but in fact, most often it's not as overwhelming as the information is showing. The information is to make sure that you are prepared in a worst case scenario, but obviously speaking, when you're advocating for somebody, it could be as simple as simply going to their doctor's appointments with them, taking information and helping them make sure that they have the services they need and the medications they need, etc.
There's someone with their hand up. Do you want to unmute yourself? Yep, Marianne.
Yes. Right now I'm taking some courses through hospice, St. Joe's Hospice.
Yep.
And right now I'm going to be a volunteer going into the homes and eventually do some advocacy and also some spiritual. That's my end goal. And I was wondering if this course seems to be part of or an additional to what some of the courses I'll be taking.
Mm-hmm.
I was wondering if they are intermingled, or are you part of St. Joe's Hospice, or are you totally different?
So we're different completely, but they have maybe similar programs that they offer. But we definitely encourage, dialogue between the groups. So if they are aware of what we're doing, it's a very practical approach. So we'd appreciate your contact if you have someone there that we can speak to.
So for instance, Marianne, our visiting program that we have,
Mm-hmm.
it's the orientation of it is to be very practical. And so the training we try and do is very practical. Whereas I know of other visiting programs that are done, which are very sort of, oriented towards convincing you that it's a good idea to visit. Well, I think that it's obviously a good idea to visit, but the more important thing is the practical information for actually doing it. So that's sort of my point of view. So it's the same thing with the patient advocacy program that we're working on. As we have here, we're trying to make it quite practical, things you need to know. And some of it's overwhelming, I just to say, because we just went through, an hour and 54 minutes together. Nonetheless, I think it was helpful.
Go ahead, Michelle. Sorry.
Yeah. Alex, yesterday, I think you talked about how we are not professionals, but that we are being human. Would you repeat that phrase? I thought that was really well said.
Oh, well, the role that we're really working on is recognizing our need to help the other, to be with the other, but it's recognizing the nature of the human person. A lot of people miss this concept today of what it means to be human. And we have to understand that we're all different. That's correct. We all have different, experiences in life. But as human beings, we all have the same things in common. We're all, we're physical beings, we're psychological beings, we're emotional beings, we're spiritual beings. We all have these same things that we have in common, and we all experience the same things. So as I was explaining last night, I might, if someone's experiencing a lot of pain, I may not, fully understand that pain, but I understand the concept of pain. So I understand, I have empathy for that person, and I understand them. But I also understand that when they're in pain, it affects them emotionally, it affects them psychologically. And I understand that because I'm a human being and the same thing affects me. So we have to understand where someone's coming from. And I was trying to emphasize last night that, so I was talking about issues around euthanasia. And with euthanasia, someone's asking for their life to be ended. And I was saying, well, there's many reasons why someone's asking for their life to be ended, but we have to look at it from what does it mean to be human and why are they reacting this way? Putting them into that place. Let me give you another better example. I was talking to somebody just the other day who has a son who is also autistic, and he's going through a very difficult time. And she mentioned that he doesn't get out of his bed until into the afternoon. He doesn't go anywhere. He doesn't really do anything. He's caught up into this world. He wasn't quite like that before, she said. Like COVID sort of got him deeper into this. He wasn't really social before, but I mean, he wasn't quite like he is now. And she says, and he's becoming a bit suicidal. And my comment to her was, that's terrible. And there's lots of things that you're going to have to do to deal with that. And it's difficult. There isn't any easy answers. But I said, if you were sleeping in till the afternoon and not going anywhere, not doing anything, and you spent your whole day like this and your whole life this way, you might be pretty depressed too, and you might be becoming suicidal yourself. So what my point was is we understand where they're coming from as a human person, even though I might not be in that situation particularly. I do understand what they're going through, and that's how we try and connect. So when you're dealing with people, we have to try and connect. That's how it works. So if I'm advocating for somebody and they're having a difficulty with something and they have a difficulty expressing themselves and everything, our goal is to try and connect with them, try and as a human being, create that sort of bridge so we can be helpful and representative for them. Same idea when you're visiting somebody, you're creating that human interconnection. And then I always point out, God actually made us this way. Now, for those of you who don't believe that God made you this way, then let's just say you were evolved to be this way, but you are interconnected beings. That's how you are. And everything about us shows us that's true. That's how you are. You interconnect. You react this way, you live this way, you are this way. This is how you are. You need others and they need you. So the difficulty in the community we have today is what? We have we have removed the interconnected nature of the human person. We're stopping living in community. We split up our families. We don't recognize the same way as we used to, where you were part of a social group that you fit in with, right? We used to have families who lived together. I'm not saying you should live together in large family units. I'm not saying you should do that. What I am saying is that was the common thing not so long ago, and that was normal to the human person to be like that. So what you had is you had grandparents and grandchildren in the same home. Well, obviously speaking, there was more of a social cohesiveness because you had this interconnectedness between generations. We've lost it. We've lost a lot of things that way, and it's creating a problem for us. We're losing our moorings. And it's a problem. So we need each other. Why are you visiting people? Because people need you and you need them. Why would you be an advocate for somebody? Because the world looks at that person differently because they have community, but also because you care about somebody enough that you want to help them. So sometimes being there with them is all that's necessary, and sometimes there's going to be a lot more to it. So.
Sorry, Alex, there's another question from Cynthia. Has it ever happened that a client may fire the advocate because of family pressure? And if so, does all medical records go back to family?
All medical records go to the person. That's the person. Everything that you've done with that person is owned by that person. So let's say you're taking notes. Those are not your notes. You're taking notes for what reason? To help that person receive the help that they need, right? So let's say you have certain notes that you've taken because you've gone with them to a doctor, as an example. Those notes are private information that are not owned by you at all. It's owned by the person you're going with, right? That's who has them. So yes, you would give it to them. It's you were only an advocate. You were only being there to help them, and hopefully you were appreciated for what you did. Sometimes it's very difficult to be an advocate because you might become an advocate because the family really can't be trusted. I hate to say that. Oh, and it's painful and it's not easy. And sometimes you're only doing it because you really respect that person you're advocating for. You really respect them. And so you're doing the best you can to make their life better. So.
And just a quick note, if I may add here, some of you have not been aware of, or maybe weren't aware of, that we have Being With My Story volunteer training program. This just happened this week. We had another session just on Tuesday and Wednesday night. It's a program where we teach how you can be with others and simply beyond just being an advocate, but you're sharing time and you're spending time, and you have a book that you can get from us as well. It's called the My Story Workbook. It's filled with questions that you can ask about their life. And you also have a training manual. We offer this training together pretty much every month to every 2 months with Alex and myself, and they're free, just like tonight's session is free, and you can get these books sent to you as well. So if you are interested in getting onto that and joining that group as well in a session coming up, then just email us. We'll send you the next one when it's available. Okay.
Well, nothing is free. The session is free, but we
The
hope you
session's free,
donate
yes.
because
That's
none of
right.
this is free.
No. Yes.
Believe it or not, Kathy is not doing this for free. She's
Yes.
working very hard. She's
Yes.
been very effective, and we're very thankful to her. But obviously speaking, donations are necessary.
Yes.
So anyway, it's 9:01, so I think we're done. If there's any questions, please send them to Kathy.
Yes.
She'll be happy to deal with them. And if there's any suggestions, even if you say we should have done something differently, that's fair game. Please send those. No one is suggesting that what we did was absolutely perfect today. And we're happy to improve over time. And thank you for everybody joining us. Many of the people I see here, we've seen before, and you're becoming like good friends, and we're happy to have you around us. We have to do this more often, you know.
Yes.
And actually, Kathy was talking about last night doing sessions that are just for discussion about our experiences, because some of you are doing visiting, as an example. You're involved with visiting certain people in your communities, etc. Maybe it's through your Catholic Women's League group or your Knights of Columbus group, or maybe it's just through the fact that you're doing it in your community. That would be helpful if we actually had Zoom meetings every once in a while. We just share the information together and help each other learn from each other, okay? And I think that that's a good thing to start pretty soon. Thank you very much.
Thank you, everyone. Thank
Right.
you so much. Have a wonderful night.
Thank